you have our commitment and our partnership to make significant progress together.
Welcome to the Global Health Catalyst series, and with me, I'm honored to host Dr. Glen Gaulton from Upenn. And well, first of all, welcome, Doctor.
Thank you.
Would you kindly introduce yourself to us? And
Yeah,
who
sure.
are you? What do you do at Upenn? I know you're part of Global Health.
Yeah, no, a pleasure. So I'm the director of Penn's Center for Global Health. We are based in the School of Medicine, which is Penn's largest school. There are 12 schools at our university. It's an enormous number of faculty, well over 3,000. We also own our health system, so it's a combination of a school and a large health system. So we think a lot about healthcare, how it's delivered in a practical sense, not just making great discoveries to move healthcare forward.
I love the whole part about the practicability of healthcare.
Yeah.
So with that said, you're hosting the Global Health Catalyst this year.
Yeah.
What does that mean for an institution like UPenn and your cancer center?
Yeah, well, we've been involved through our colleague, Dr. Stephen Avery, for many, many years in the summit. And, for us, particularly hosting it this year is just an honor to have everybody on campus and to hear a little more and learn a little bit more about what we're doing, which is great. I probably don't need to tell the audience that's going to be at the summit about the importance of cancer worldwide. This is an incredible and a growing problem, and resources to support awareness and provision of care and the long-term management of chronic, hopefully what would become either a chronic disease or a cure for cancer. Requires an awful lot of effort and talent. And so we're delighted to share the kinds of things we've done, the approaches that we take, and along the way showcase a little of our approach as well.
Absolutely. And you are making some remarks on day one of the Global.
I am. Yeah, so I'm going to be one of the individuals. I think Stephen has scheduled many individuals to he tends to do that, but he scheduled many, and I mean that in a good way. He scheduled many individuals to make introductory remarks. I think, the importance, particularly for the Center for Global Health, so we are the umbrella organization within our institution that coordinates the many, many things that are going on in all of our clinical and our basic science departments. Is that we're bringing all this together, and we'll be launching a little later this spring a global cancer program specifically directed to Penn's community and how we can make the biggest impact in cancer care around the world. And one of the major regions that we focus on is, of course, Sub-Saharan Africa.
Yay, as somebody from originally from Sub-Saharan Africa, I am grateful because I have lots of families still there.
I'm sure. Yeah.
I'm the only prodigal child who decided to leave in the family. But so I would like, with that said, I'd like to say thank you for everything you're doing for, cancer treatments across the world, and research and bridging those disparities. But in terms of this particular summit, what are you looking forward to in terms of outcomes and just the way forward?
Well, I think and I mentioned this at the beginning, Penn is on the basis of our founder, Benjamin Franklin, we are a practically focused institution. So to me, the issues are, how can the catalyst focus on approaches, not just talking about what happens in cancer and the differences in different countries or regions, but what can we do in a very practical sense to improve the lives of individuals that have cancer diagnoses, to make their whole situation, more facile, easier, and then bring forward, again, in a real way, how to bring forward approaches and hopefully, treatments and cures to address these problems. So for me, sometimes conferences and symposia become very theoretical and people are talking about all these wonderful ideas, but they tend to forget sometimes the boots on the ground reality. And particularly in sub-Saharan Africa, and the conference obviously is focusing on that region. A lot of the problems are infrastructure problems and resourcing problems, in addition to the more classical sort of training and knowledge-based problems. And so you have to blend all these things. So again, my hope is that the summit will focus on solving real world problems.
Absolutely. I'm so glad that you mentioned that, because the other thing, in addition to what you said, the sub-Saharan Africa is not a monolithic area.
That's
so
right.
Each of the countries has its own unique challenges. So the whole idea of having to factor in those challenges.
Oh boy, isn't that the case? I have to say, every new, so our Penn works in almost 70 countries around the world. And of course, Africa is a very big continent, and the variety, not just the countries, but the tribal populations, the cultural differences, even within regions within a country, let alone within a country, are sometimes straightforward, but often nuanced. And particularly, I think, how those influence individuals and how individuals are cared for, and how the strategies of cancer care are brought forward to be best communicated to support individuals, but also how we work with the various government officials and institutions, because even within those cultural conditions influence, how you move projects forward in the most productive manner. Because, there are some places where we work where everybody is extremely polite and says yes, 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 and then yes, yes, yes actually means no, no, no. But nobody's telling you this, and they're just being polite. So some of it is that, and it also is a part of, I think, making long-term commitments to locations and countries and institutions. So as an example, one of our main sites of work is in Botswana, and we've been there now, oh my gosh, 23 plus years. Working in Botswana. So it's a very long-term commitment by our institution. And even with that length of time, to build trust, and so that people feel comfortable telling you, either directly or behind the scenes, how to really, what's really happening and how to move things forward is just absolutely essential. Yeah.
What you just mentioned just reminds me, even here locally, I'm in Massachusetts, and I'm a co-operator for one of the local hospitals, Emerson Hospital. And one of the realizations they had is that they needed their staff to have cultural competence, because we have a growing number of immigrants. And I actually gave a bit of cultural competence training for the perinatal unit, because they were having those challenges: how to communicate with the parents, how to provide good services for the newborn kid, the expecting mother. It was a little problematic. So, yeah.
Yeah, one of the things I do when we first go to a new location, the conversations I have early on with individuals, and I try to spend time understanding, of course, in the beginning, what they want, and and does it therefore make sense for Penn or our investigators, faculty, et cetera, clinical individuals to be there? I mean, can we really, does it mesh appropriately with us and with them to make it work? And 100% of the time, what I hear from our colleagues is, whatever you do, if you commit to do something, stay with us. Because part of the challenge, I think, in many ways, of the way that global health has been funded in the United States is through boluses of funds, and those funds come and go because of the nature of US funding institutions. So someone will get a grant, and that grant will last 3 to 5 years. And at the end of that 3 to 5 years, how are they going to continue the work and the project? And so those are the reasons why I think institutionally it's important for institutions, and most institutions, at least in the United States and many parts of the world, have centers or offices like ours, and Center for Global Health, where there's an institutional commitment. It isn't just an individual or a small group of individuals who are dedicated to a project or a place, but it's the institution that becomes dedicated as well, so that when funding kind of goes up and down, or maybe those individuals move on to other things or retire, or whatever it is, that the institution can maintain those commitments. So that's extremely important to us.
Absolutely. No, I am so glad that you raised that. And I hope people who are watching this and are, involved in global health can really take this at heart, because it's the way that, development can be sustainable. And that's very key, the sustainability angle. So with that, and I will be there to, hopefully I'll have more opportunities to have more conversations around this with you at the summit and beyond. But for now, I really wanted to say thank you for taking the time to speak with me and to share a little bit about your insight in global health with us. Oh,
it's my pleasure. I mean, we care deeply about this at our university and our School of Medicine and Health System. So, our faculty, as I always say, when our individuals, our healthcare professionals trained in whatever, their field, the technical individuals, the nurses, the doctors, et cetera, they didn't train just to work in Philadelphia. They trained to help people, regardless of where they are. They just happen to be based in Philadelphia.
Right.
So there's a commitment by, the vast majority of our professional workforce to just help broadly. And, so that spills over well beyond Philadelphia to other parts of the United States and throughout the world.
Right. And it will be great. It's great to always see the diversity in the room. And I hope it translates into diversity of ideas and diversity in impact.
Yeah, so absolutely.
Healthcare disparities. But yeah, again, great to meet you. And thank you for speaking with us.
Oh, a pleasure. Look forward to see you next week.
Absolutely. And to our viewers, thank you for watching. And please look out for more videos on the Global Health Catalyst series. Again, thank you for watching. Till next time.